Serious situation.
Due to serious complications.
Take measles seriously.
Very serious illness.
Serious situation on our hands.
This is serious.
We have to take this seriously. This outbreak. Measles
outbreak. Since this outbreak is the largest outbreak due to this measles outbreak, during this outbreak, this outbreak, in this outbreak, the outbreak.
A large outbreak, an outbreak.
Dangerous disease can be. This dangerous disease, children are in danger. The danger of the disease, pregnant women can be in danger. Folks going through medical treatment, such as chemotherapy, can be in danger. Senior citizens can be in danger. This is a broader danger. A dangerous disease spreads.
It's very dangerous.
Health dangers. The danger is, in the meantime, something horrible can happen. It can be really dangerous. That's why I just want to understand how dangerous this is. Disease. This is a disease. Measles is so contagious, can spread so quickly. How highly contagious.
Measles is a very highly contagious disease.
It can spread and be visible very, very quickly. This spreads so quickly, so intensely.
Readily transmitted person to person.
You can be infectious 4 days before you actually develop the rash.
Is infected.
When they're infectious.
Yeah, you're basically spraying out measles. It's airborne.
Right, an airborne disease.
And it can last for 2 hours after the person has left the room.
And the results can be devastating. For those that live, there can be brain damage, but it's also important to understand measles is not a disease to dismiss. Measles can be fatal.
It protects other people's children. It protects members of the community who are vulnerable to disease and are unable to get vaccinated, such as infants, pregnant women, cancer patients on chemotherapy, and other patients with weak immune systems are protected when you get vaccine. We have people living longer with severe medical conditions who are on chemotherapy, and those people are at risk.
There are many more individuals who are living with chronic diseases, who are surviving cancer, and so we don't want children or adults to be unnecessarily exposed to measles. Young children and people who have weakened immune systems cannot get vaccinated, so it's crucial that everyone around them be vaccinated in order to shield them from infection.
The measles vaccine works. It is safe, it is effective, it is time tested.
This vaccine is safe.
Vaccine has been proven to be safe and effective in preventing the spread of measles for decades, and we have evidence to back that up. Before the vaccine was introduced in the 60s, about 500 people would die each year in the United States due to this virus.
The science consistently proves that this vaccine is safe and necessary.
And it's not dangerous to get a second vaccine.
You can't get the measles from the vaccine.
Get the measles vaccine. Get the measles vaccine. Get the measles vaccine. Please get the measles vaccine.
Get vaccinated. Get vaccinated and get vaccinated.
To get vaccinated. That vaccination is in fact critical.
Anyone who is unvaccinated gets vaccinated here.
Maximize the number of people that are getting vaccinated, who have been vaccinated.
Get people vaccinated, get people vaccinated.
Get vaccinated for them to get vaccinated.
To get kids vaccinated, adults who need to get vaccinated as well.
Get the vaccine.
To make sure people are vaccinated.
Be vaccinated to be vaccinated.
There's a lot of misinformation out there about this virus and about vaccines.
The dangerous misinformation that is being spread by a group of anti-vaxxers.
There are people who are trying to spread misinformation.
Where a lot of misinformation is being handed out with very intentional efforts to give misinformation, and we're here to correct the record. Misunderstandings and frank untruths that are being propagated of a large anti-vax movement, very aggressive anti-vax campaigns.
A healthy thing to do, or that it would harm a child?
I cannot speak, honestly, I cannot speak on the part of the anti-vaxxers in any credible way. Increasing anti-vax campaign. We are certainly seeing it in New York. It is certainly a big contribution to this particular outbreak. There are people actually urging people against vaccine. Again, it is critically important that all community members, and we rely on you, the media, as our partners, to get real information out there, to make sure people know that vaccines are safe, that they are required, that they are in fact much safer than getting actual disease, that this is not like some little cold thing, that people can get hospitalized, they can get pneumonia, they can get inflammation of the brain, they can die.
Measles can be fatal.
It can even be fatal. And it could even be deadly.
No one has died so far.
No one has died.
We haven't seen a death yet.
New York City Department of Health is the gold standard in public health, and they call the shots. We are absolutely certain we have the power to do this. The city government is empowered in a public health emergency. We are absolutely certain this is an appropriate use of our emergency powers. If anyone is thinking of a legal challenge, we are absolutely comfortable that we will win. This has been thoroughly evaluated by our law department. The city government has the ability to issue violations and to implement fines, and they're very substantial fines. We do not want to have to do that. We do not want to issue fines. If people ignore our order, we will issue fines. Again, that is not a tool we want to use, but it is one we will use if we have no choice. Our goal is not to fine anyone.
If they choose not to be vaccinated, then they will be fined.
Our goal is not to shut down schools.
Potential closure if they are not cooperating with the exclusions.
No one has to pay a fine if they're doing the right thing. But if folks ignore this order, then they are subject to the fine.
Children are being appropriately excluded under this order.
Whenever people comply promptly, we will not have to, or we will not have to levy fines. If people will simply cooperate quickly, and the faster people heed the warning and act on it, the faster we'll be able to lift the order. So what you heard from the two doctors is the better way to think about this.
We're not looking to get anybody in trouble. People in violation of the order will be identified through investigations of exposures.
It parallels what a police detective does. If someone has symptoms, they literally will interview them to figure out everywhere they've been, everyone they might have come in contact with.
Our disease detectives will check for vaccination status or immunity when tracing the contacts of a person who has developed the illness. If the department identifies an adult or a child with measles or an unvaccinated child exposed to measles, the individual or their parent or guardian will get a violation that could be fined $1,000 per instance, so that people feel comfortable disclosing who they have come in contact with.
A lot of people, when they're informed of the fact that someone else might get sick and it could be really dangerous, are very forthcoming with information.
We've seen 285 cases of measles in New York City. 246 have been in children, and nearly all of them have been associated with the Orthodox Jewish community. The religious leaders that we have met with have made it clear that there is nothing in Talmudic law that prohibits vaccination.
To wish everyone Aziz and Pesach, a sweet Passover. But to make sure it is a good holiday.
When you're vaccinating, when you're making the decision not to vaccinate, you are de facto making the decision for the people around you.
That's right.